Hello students, in the today's session we will talk about the pharmacology of antipsychotic drugs. Antipsychotic drugs are the drugs that improve symptoms of psychosis, primarily schizophrenia. Schizophrenia is a psychotic disorder. It is a type of psychosis. Schizo refers to split and phrenia refers to mind. So schizophrenia refers to split mind. This is a disease in which a person is unable to differentiate between real and unreal. And antipsychotic drugs are broadly categorized into two categories: typical antipsychotics and atypical antipsychotics. Now, before discussing typical antipsychotics and atypical antipsychotics, now let's talk about the symptoms of schizophrenia in brief and pathophysiology of schizophrenia in brief, so as to understand pharmacology of antipsychotic drugs. Symptoms of schizophrenia are broadly divided into three categories: positive symptoms, negative symptoms and cognitive symptoms. Now, positive symptoms are the change in behavior that is not seen in the normal population. So, positive symptoms refers to abnormal behavior, and these positive symptoms are delusions. Delusion refers to strongly held false beliefs. The affected individual is extremely suspicious and afraid of people. Now, this delusion can be, for example, delusion of control, where the affected individual feels that thoughts are inserted from outside. Somebody is controlling the thoughts. Then another symptom is the hallucination. Hallucination refers to false perception. It can be a false visual perception, false auditory perception. It can be a false olfactory, gustatory or tactile perception. Then third positive symptom is the disorganized speech, often referred as word salad, where there is no link in the thoughts and speech, and many a times affected individual keeps repeating the same sentence or the same word again and again. Then catatonic behavior. This refers to reduction in the physical movement, and physical movements are reduced to an extent that voluntary movement of the body completely stop, which is referred to as catatonic stupor. Now, next category of symptoms are the negative symptoms. Negative symptoms are the absence of normal behavior. These are the absence of normal behavior in the affected individual, or there is diminished normal behavior in the affected individual. Now, these negative symptoms are affective flattening, where the affected individual stop showing the responses. There is blank and restricted facial expression. The voice becomes flat. There is no voice modulation. Then another type of negative symptom is alogia, where there is difficulty or there is inability to speak. Next negative symptom is anhedonia asociality, where there is inability to experience pleasure from the activities that are actually enjoyable. Then social withdrawal. The person remains aloof, the person remains unaware of the surroundings, and the person doesn't want to mix with the social gatherings, and there is low energy. These all symptoms are the negative symptoms. Apart from this, schizophrenia is characterized by the cognitive disorders, abnormal thought processes, characterized by disorganized or the slow thinking, poor memory, inability to concentrate, judge, plan, organize and make decisions. Now let's talk about the pathophysiology in brief. This slide talks about the pathophysiology of schizophrenia. Dopamine plays a very important role in the pathophysiology of schizophrenia. There are four main dopaminergic pathways, and we'll be talking about all these pathways one by one. This is the diagram showing the brain and the brain stem. The first pathway is the mesolimbic pathway. Mesolimbic pathway extends from the ventral tegmental area to the nucleus accumbens. This mesolimbic pathway I have shown here in the blue color, and this mesolimbic pathway is found to be hyperactive in schizophrenia, and hyperactivity of this mesolimbic pathway is responsible for the positive symptoms of schizophrenia. And those drugs which are found to block dopaminergic D2 receptors, they reduce the availability of dopamine in mesolimbic pathway, and they are found to improve symptoms, they are found to improve positive symptoms of schizophrenia. The next pathway is a mesocortical pathway, and this mesocortical pathway I have shown here in the red color. This mesocortical pathway, it extends from ventral tegmental area to the prefrontal cortex, and this pathway is found to be hypofunctional in schizophrenia. And since this pathway is hypofunctional, hyperfunctioning of mesocortical pathway is responsible for the negative and cognitive symptoms of schizophrenia. Third pathway is the nigrostriatal pathway. Nigrostriatal pathway is the pathway I have shown in the blue color. This nigrostriatal pathway, it extends from substantia nigra to striatum, and this pathway, it controls and coordinates body movements. Now, deficiency of dopamine in nigrostriatal pathway results in extrapyramidal side effects, that is Parkinsonism like side effects and tardive dyskinesia. The fourth dopaminergic pathway is the tuberine fundibular pathway. This pathway I have shown in the red color, and here the dopamine inhibits the release of prolactin, and those drugs which block dopaminergic D2 receptors increase the release of prolactin, and increased release of prolactin is responsible for symptoms like galactorrhea and gynecomastia. Now, coming back to the classification of antipsychotic drugs, these are broadly categorized into two categories: typical antipsychotics and atypical antipsychotics. Typical antipsychotics are the first generation antipsychotics. These are the old antipsychotics, and these are found to be effective in controlling the positive symptoms of schizophrenia. They are not found to be effective in the symptomatic control of negative symptoms of schizophrenia, and these typical antipsychotics, they also produce symptoms like extrapyramidal side effects, that is the Parkinsonism like side effects and tardive dyskinesia. And apart from this, most of the typical antipsychotics also increase the level of prolactin, thereby causing galactorrhea and gynecomastia. Under the typical antipsychotics, we have phenothiazines, butyrophenones, thioxanthines and other heterocyclics. Under phenothiazines, we have chlorpromazine, triflupromazine, thioridazine, trifluperazine, flufenazine. Under butyrophenones, haloperidol, trifluperidol, panfluridol. Under thioxanthines, we have flupentixol. Other heterocyclics, mimoside and loxapine. Now coming to the atypical antipsychotics. Now these atypical antipsychotics, they are not as efficacious as typical antipsychotics in controlling the positive symptoms, but they are useful, they are found to be effective in controlling the negative symptoms of schizophrenia also. And apart from controlling the negative symptoms, most of them they are devoid of, or they show extrapyramidal side effect to a very less extent, and most of them they also do not cause increase in the level of prolactin, they do not produce galactorrhea and gynecomastia. So under the atypical antipsychotics, we have clozapine, risperidone, olanzapine, quetiapine, aripiprazole, ziprasidone, amisulpiride and zotipine. Now we will talk about the typical and atypical. Now under the typical antipsychotics, we will be talking about chlorpromazine. Chlorpromazine is the main prototype drug. This slide talks about the pharmacology of typical antipsychotics. As we have already discussed, typical antipsychotics are the old antipsychotics, and these are also called as the first generation antipsychotics. The prototype drug is a chlorpromazine. Now, when we talk about the pharmacological actions of chlorpromazine blocks dopamine D2 receptors. It blocks dopamine D2 receptors in all the 4 dopaminergic pathways. Now, it blocks dopamine D2 receptors in the mesolimbic pathway, and by blocking the dopamine D2 receptors in the mesolimbic pathway, it reduces the availability of dopamine in this pathway, or it reduces the overactivity of dopamine in mesolimbic pathway. And by reducing the availability of dopamine in the mesolimbic pathway, chlorpromazine reduces positive symptoms of schizophrenia. And this blockage of dopamine D2 receptor in the mesolimbic pathway is responsible for the antipsychotic effect which is produced by typical antipsychotics or by chlorpromazine. And thus the blockage of dopamine D2 receptors reducing the availability of dopamine in the mesolimbic pathway, they are found to reduce the positive symptoms of schizophrenia, that is the symptoms like delusion, hallucination, disorganized speech. These are suppressed by chlorpromazine and by all the other typical antipsychotics. Now, apart from reducing the availability of dopamine in the mesolimbic pathway, these drugs also reduce the availability of dopamine in mesocortical pathway, which is already hypofunctional in schizophrenia. So, typical antipsychotics like chlorpromazine, they reduce the availability of dopamine. They further cause a reduction in the levels of dopamine in the already hypofunctional mesocortical pathway, and this results in the worsening of negative and cognitive functions of schizophrenia. So, mostly all the typical antipsychotics, they are found to be effective in reducing the positive symptoms, but they cause further worsening of negative and the cognitive functions, and therefore these drugs are nowadays not preferred in the treatment of schizophrenia. Now, apart from mesolimbic and mesocortical pathway, these drugs, they also reduce the levels of dopamine in the nigrostriatal pathway, which is responsible for the control and coordination of body movements. And now, reduction of reduced availability of dopamine in nigrostriatal pathway produces extrapyramidal side effects like Parkinsonism like side effects, that is muscular rigidity, that is the muscles, they become very stiff. There is pain on the movement of muscles, there is muscular rigidity, there is difficulty in the movement. Tremors refers to the involuntary shaky movements, so tremors. Hypokinesia refers to less movements. Masked faces, because of the reduced movements, there is reduced facial expression, and because of the reduced facial expression, it looks as if the person is very serious or the person is staring in one direction, and the face is expressionless, referred to as masked face. Then shuffling gait refers to the balance problem, and the person seems to be leaning forward, that is the stooping or hunching body gait. Then apart from the Parkinsonism like side effects, it also produces tardive dyskinesia. Tardive dyskinesia is characterized by involuntary facial and limb movements like chewing, continuous chewing movements, puffing of cheeks, then licking of the lip licking, and then chorioathetoid movements. Chorioathetoid movements refer to irregular, unpredictable, involuntary contractions of arms and legs, twisting and writhing of the muscles of arms and legs. So, these all extrapyramidal side effects are produced because of the deficiency of dopamine in the nigrostriatal pathway by typical antipsychotics like chlorpromazine. Typical antipsychotics like chlorpromazine, by virtue of blocking the dopamine D2 receptors, they also reduce the levels or availability of dopamine in the tuberoinfundibular pathway, and reduced dopamine in this pathway results in the increase in prolactin, as we've already discussed while discussing the pathophysiology of schizophrenia. An increase in the levels of prolactin results in galactorrhea, symptoms like galactorrhea and gynecomastia. Now, apart from blocking the dopaminergic D2 receptors, most of the typical antipsychotics and chlorpromazine, they also block the alpha adrenergic receptors. And because of the blockage of alpha adrenergic receptors, these drugs, they produce hypotension, and they also produce reflex tachycardia. And different drugs show different degrees of blockage of alpha adrenergic receptors. Now, these typical antipsychotics, apart from blocking the dopamine D2 receptors, apart from blocking the alpha adrenergic receptors, most of the typical antipsychotics, they also block the cholinergic receptors. And because they block the cholinergic receptors, they produce cholinergic side effects like dry mouth, blurred vision, constipation, urinary retention. And again, the degree of blockage, it differs, it varies from one drug to another drug. Typical antipsychotics and most of the typical antipsychotics and chlorpromazine, they also exhibit weak H1 antihistaminic activity, and because of which phenothiazine, that is a chlorpromazine, they produce sedation and they also produce weight gain. Chlorpromazine and most of the phenothiazine, they block histamine H1 receptors, D2 receptors, and cholinergic M1 receptors and chemoreceptor trigger zone, and therefore chlorpromazine and most of the phenothiazine, they exert antiemetic action. Now, coming to the atypical antipsychotics, these are the newer antipsychotics, these are the second generation antipsychotics, and these drugs, they have less affinity for D2 receptors compared to typical antipsychotics. Compared to chlorpromazine, they are weaker antagonist of D2 receptors. They show weak D2 blockage activity, and therefore they are effective, but they are not as efficacious as typical antipsychotics in reducing the positive symptoms of schizophrenia. But compared to the typical antipsychotics, they are found to be more efficacious in controlling the negative and cognitive symptoms of schizophrenia, and therefore nowadays atypical antipsychotics are preferred compared to typical antipsychotics in the treatment of schizophrenia. And these drugs, they produce minimal extrapyramidal side effects. The prolactin levels also do not rise because these are not the potent blockers of dopamine D2 receptors. They do not cause much reduction in the levels of dopamine in the nigrostriatal pathway, and therefore they exhibit minimal extrapyramidal side effects. On the other hand, they also do not produce very low levels of dopamine in the tuberoinfundibular pathway, and therefore the prolactin levels also do not rise to a very high extent, and therefore they produce either no or they produce very mild galactorrhea and gynecomastia. Now, apart from the weak blockage of D2 receptors, these drugs, that is the atypical antipsychotics, they possess additional 5-HT2 antagonistic, anticholinergic, H1 and alpha adrenergic blocking actions also. Side effect profile that can be induced by these atypical antipsychotics is as follows: metabolic complications like weight gain, hyperlipidemia and hyperglycemia is produced by atypical antipsychotics like clozapine, olanzapine, zotipine. Sedation because of the blockage of histamine H1 receptors is predominantly seen with clozapine, quetiapine. Postural hypotension because of the blockage of adrenergic receptor is found to be present with the administration of risperidone, ziprasidone. So this is all about the pharmacology of typical antipsychotics and atypical antipsychotics. Thanks for watching the video.